Our February 2026 Research and Analysis Bulletin focuses upon approved premises, building understanding of the AP environment, and the barriers and enablers to the safe integration of residents from APs into local communities. Approved premises manage and house individuals assessed as posing a high or very high risk of serious harm, usually upon release from custody. With 104 APs across England and Wales, including some specialist units and women-only facilities, these settings provide structured, supervised environments that support public protection and rehabilitation. They offer temporary accommodation, key worker support, and rehabilitative interventions, aiming to address significant post-prison barriers and bridge the gap between custody and community. A primary aim is to facilitate and provide positive reintegration opportunities. Through providing such opportunities and a range of rehabilitation and recovery-focused activities, APs can support individuals in their desistance journeys, which involves longer-term changes in behavior, identity, and social relationships. In this study, the research questions were as follows. 1. Are AP residents adequately prepared and supported to safely integrate into communities? 2. What are the key challenges and barriers faced by APs in supporting the safe integration of residents? 3. What are the key enablers and good practices in supporting the safe integration of residents and in building relationships and partnerships between APs and local services and communities? The research took place between March and October 2025. It used a mixed methods approach to answer the research questions, comprising 3 work streams. Firstly, a literature review. Secondly, qualitative analysis based on interviews, ad hoc conversations, and observations with residents and professionals at 5 AP sites. And, finally, 2 sense-checking workshops with professionals. Analysis of all the collated data and literature led to the identification of 12 themes related to the success of APs in supporting the safe integration of residents into the community. These themes have been categorized as contextual factors, system-level factors, key practices, and social and relational factors. Starting with contextual factors, APs are a unique environment, accommodating a high-risk and high-need cohort, acting as a bridge for adjustments from custody to community living. They are seen as distinct from prison and independent from mainstream probation, and are sometimes misunderstood and undervalued within the wider service. The research suggests 3 system-level factors are important, starting with integration and desistance supporting policies, which facilitate appropriate and timely placements into APs, and ensure sufficient placement lengths for residents. Additionally, flexible and tailored policies have the potential to reduce the bureaucratic burden upon staff, freeing up their time for meaningful engagement with residents. Next, sufficient funding and resources are required for successful reintegration. This includes appropriate funding, managerial autonomy over how funds are spent, and a stable and skilled workforce. Finally, accessible, well-resourced rehabilitative community services, including effective partnerships with local authorities and other providers, are vital to achieving desired outcomes. The next set of themes are all key practices. Firstly, early and comprehensive planning, with thorough pre-arrival preparation, structured induction, and ongoing collaborative review. Next, offering a wide range of rehabilitative activities to address needs, develop practical and desistance supporting skills and knowledge, and create structure for residents. Providing effective staff training and support is also important, including space and opportunities for reflective practice, dedicated psychological support, formal training, and informal peer learning. And finally, responsive practice, enabled by staff's close understanding of residents' needs and motivations, to inform tailored and flexible support offers at time of need. The final set of themes are all social and relational factors. Cohesive and collaborative teamworking is critical for the effective functioning of APs, characterized by strong interpersonal relationships, inclusive practices, good staff dynamics, and collaborative leadership. A safe and rehabilitative culture is vital, and is fostered through a balanced approach to risk management and rehabilitation, in which staff and residents feel safe and supported. Rehabilitative relationships, defined by respect, trust, care, dedication, open communication, and use of procedural justice, foster engagement and empowerment. Finally, an enabling social environment, shaped by the composition and motivation of the resident cohort, can enhance outcomes, but group dynamics can be easily unsettled and undermined, including because of perceived inappropriate placements. The report sets out barriers, enablers, and good practices in supporting the safe integration of AP residents and in building relationships and partnerships between APs and local services and communities. For example, this slide highlights one promising practice example in the provision of ongoing support following AP move-on, with the AP having a permanent, specific outreach worker who stayed in touch with residents. Accompanying the research report, 3 briefings have been produced, one aimed at AP staff and community service providers, one at local and regional AP managers, and one at policy and national leads. The briefings set out implications, points for reflection, and actions for further consideration. The briefing for AP managers sets out 9 implications, the first 5 of which are on the slide. 1. Strengthening partnerships with local authorities and providers. 2. Having named organizational contacts and direct provision on site. 3. Having dedicated support to identify and make links with potential employers. 4. Striving for greater connectedness and improved relationships between APs and probation delivery units. 5. Providing training and learning opportunities, and routine supervision and reflective practice activities. The research report and the 3 bulletins, alongside a preliminary theory of change model, assisting with further research and evaluation, are all freely available on our website, alongside a range of other products. Feedback on all the products is very much welcomed.